Hi, my name is Jake Magel. I'm a physical therapist and an associate professor in the Department of Physical Therapy and Athletic Training under the College of Health at the University of Utah. My area of research primarily centers around studying the outcomes of patients with orthopedic conditions who access physical therapy. And more recently, I have been interested in bringing physical therapists more into an addiction medicine space where we can learn how they can play a greater role in the management of the prevention of opioid misuse and opioid use disorder in the patients that they see in the physical therapy settings. I think my research area is quite relevant simply because of the ongoing opioid crisis gripping the United States. Oftentimes, patients seek physical therapy because they're in pain, and a lot of these patients who are in pain are also taking an opioid. So, if the physical therapist can help that patient from transitioning from somebody who is taking their opioids appropriately to perhaps taking them in ways that they in other than they were prescribed, that's a good thing, and then we can prevent them from having much worse outcomes like opioid use disorder and the problems associated with that. My research, I think, helps the world because opioids are prescribed in many countries worldwide. And if physical therapists can play a greater role in helping to manage the opioid crisis, then that's really good for everybody. The CTSI has been very helpful for me. Through the CTSI, I received a career development award, and that award focused on studying the opioid use outcomes of patients after spine surgery. And it just led to multiple other projects. For example, it helped me to procure funding from the National Center for Complementary and Integrative Health for an R01, of which I'm the PI on. And that study is studying the impact of mindfulness-based interventions in physical therapy for patients with chronic musculoskeletal pain and long-term opioid treatment. And the CTSI also was a springboard to me getting several other foundation grants that focused on training physical therapists to provide opioid risk mitigation strategies to patients who are currently taking opioids. And so the CTSI has been very instrumental in my professional growth.